A new series of tests of the so-called Kremlin pill was carried out at the Moscow Medical Academy, named after SZHKT-4, in the recent past, the first medical institute. The effectiveness of this drug was tested in the treatment of those types of gastrointestinal diseases, for the treatment of which it was created in the mid-1980s. Behind the catchy advertising name Kremlin pill is a miniature electronic device, an autonomous electrical stimulator by itself. Electrical stimulation of impaired functions of the gastrointestinal tract has its own history. The first experiments in this area were carried out at the end of the 19th century, and already in 1902, in the Russian edition of the monograph by F. Lezer Surgical Care in Emergency Cases, recommendations were made to use an electric machine for the treatment of intestinal obstruction. However, the devices used for these purposes were at that time extremely bulky and inconvenient and remained so for a long time. It wasn't until 1963 that the American company Medtronic produced the first portable gastrointestinal tract stimulator in the USSR. The largest number of studies in this area took place in the early 1970s, when various devices and methods of electrical stimulation were developed and tested. Specialists of the Institute of Surgery named after A. Vishnevsky, as well as the Tomsk Medical Institute, were especially deeply involved in this, in which an autonomous electrical stimulator of the gastrointestinal tract was created in the 1980s, which still has no analogues either in Russia or abroad. It is a streamlined capsule with two hemispheres made of stainless steel, sometimes anodized with gold. The capsule is 22 mm long, 11 mm in diameter, and weighs about 5 grams. The hemispheres of the capsule separated by a dielectric bushing serve as its electrodes, and inside it there is a power supply source and an electronic circuit of the stimulating pulse shaper. When it enters a conductive medium, for example, in the oral cavity, the stimulator turns on and begins to produce weak electrical impulses. Acting on smooth muscles, they cause a response in it in the form of a peristaltic wave, which moves the capsule along the gastrointestinal tract, stimulating all its departments along the way. The device naturally lingers in those places where motor skills are reduced, and it is there that it affects the muscles of the walls for a longer time. Thus, low-energy impulses of the capsule synchronize and activate the work of the body. But how justified are the legends about the miraculous properties of the Kremlin pill? Conducted at the Medical Academy. SZHKT-4's tests have shown that in some cases it is really effective, for example, with dyskinesia of the esophagus, with dysfunctions of the large intestine and biliary tract. The test data were impressive. The improvement as a result of the therapy was achieved in 75 to 100% of cases, depending on the type of disease. There are, however, contraindications to the use of the tablet. It cannot be used for peritonitis, acute infectious diseases, some disorders of cardiac activity, and in a number of other cases. And since the recommendations in this part were strictly followed, no complications or side effects were noted. The specialists of the Academy find the autonomous electrical stimulator of the gastrointestinal tract to be quite a serious and effective therapeutic tool and recommend it for the treatment of a number of quite specific diseases. Compared with medications, the electrostimulator has an important advantage. After sterilization, it can be reused. And this, of course, reduces the cost of the course of therapy.